So now I'm going to talk a little bit about the stages of change and the use of anoretics for weight loss. So when patients are like they're resolving this, they're practicing this, they're trying to, establish this. If we prescribe an anoretic midstream, all this is suspended. Weight loss happens without trying. It's an anoretic, which means we induce we basically induce anorexia, so patients oftentimes stop eating. They are losing weight very quickly. They're achieving the desired results, so this is not happening. There's no real way to teach intuitive eating or having someone listen to their body's messages or cues because they're not there. So oftentimes what happens is once the anoretic is no longer being prescribed, the only thing the patient knows is going back to where they started, which is here. So it's that action, going back to the default, which is the contemplation stage, and thinking once again about how I'm going to get out of this. So patients, when they don't feel hungry, they're not going to eat. When I do diet histories with patients on anoretics, they are consuming generally less than 500 calories. I have seen, oftentimes I see patients who are having symptoms of low blood sugar, but they don't feel hungry, so they don't know what this is. They've never experienced that before. So sometimes it's a little tricky. It's also awkward sometimes to tell a patient, you have to eat, even though you're not hungry. I really have a hard time doing that because that's really what got them in their situation in the first place. So we have to be really careful with how and when we prescribe these drugs so that the patient can be the most successful, the most successful possible. Let's see. So when we're talking about change and they're not feeling hungry, it's hard to make a lifestyle change when you feel nothing down here in terms of hunger. And these anoretics, unfortunately, are disproportionately sought by and used by women. So sometimes this can feed into disordered body image issues, disordered eating patterns, and if we're not aware of some of this, we might be doing more harm than good.